Daniels, you gave a beer to a patient in alcohol withdrawal.
No, it wasn't exactly protocol, but...
You didn't just break protocol. You broke every rule of medicine. We could have helped Hannah. Gotten her treatment, saved her life.
Yeah, I wouldn't have done it if you had just listened to me. I proved to you she was an alcoholic.
The bottle of alcohol in the patient's hand, that was for me. I gave it to her on purpose to prove she was an alcoholic. Not long after, a group of trauma patients came into the ER, and one of them was Hannah. While I was treating her wounds, she seemed really restless, hypersensitive, and then she started hallucinating. Right away, I recognized something: spider angiomas. Those tiny blood vessels that look like spider webs. They're subtle, but they usually show up in patients with liver disease. That told me everything she must have been in withdrawal. She was definitely an alcoholic.
How dare you!
I'm just trying to help, okay?
Who do you think you are? Get off of me! You don't know anything about me! Nothing!
Whoa.
When I called her out on it, she completely lost it. Dr. Devin tore into me. He said I should never call out a patient like that in the middle of the ward. I honestly didn't get why he was so harsh with me. Later, I pretended to apologize to Hannah. I loosened her restraints and left a beer right by her bed. I was determined to prove I was right. Sure enough, just like I expected, Hannah couldn't resist. She downed the whole bottle. But then Devin found out, and when he did, I froze.
Are your patients just pawns to prove how smart you are?
What? No. What? Of course not. I was just trying to...
I hope you took a picture of that champagne tab, because it's going to be your last.
He said he was gonna fire me.
If I get kicked out, I won't be a doctor.
Maybe that's for the best.
What did I do that was so wrong? Luckily, Dr. Conrad spoke up for me. He told Devin to let me shadow him, to give me a real chance before making the final call. Conrad took me with him to see AJ's mom. She's in late-stage cancer. Her options were brutal. Either keep suffering through painful immunotherapy or stop treatment altogether and just hold on to whatever comfort she could. Watching Conrad in that conversation was eye-opening. These life and death discussions, they're some of the hardest things a doctor ever has to face. I paid close attention to how he handled it, how he spoke, how he showed respect for her choices, for her life.
So hard for so long. And now you're telling me there's no hope.
He didn't just hand her an answer, he walked her through every option, carefully weighing the pros and cons. That honesty, that respect, it showed me what it really means to carry the weight of being a doctor. Later, Devin came back to talk to me. He told me about a mistake he made during his own residency. He once did CPR for over 30 minutes on a 1-year-old drug addict. In the end, the patient was brain dead, but her family couldn't let her go, so her suffering was just prolonged. He told me he learned then, the patient's best interest always has to come first, always. And then he told me he'd give me another chance, the same way someone once gave him one. Hearing that, I was genuinely grateful. I promised him I wouldn't let him down. That whole experience taught me something I'll never forget. Being a doctor isn't just about skill, it's about compassion. You need both.